Hi, I'm Bob Jacobson. I'm the Medical Director for the Population Health Science Program of the Robert D. and Patricia E. Kern Center for the Science of Healthcare Delivery at Mayo Clinic. And I'd like to talk to you about a commentary that we've published in Mayo Clinic Proceedings entitled Population Health as a Means for Healthcare Organizations to Deliver Value. We take very seriously the concerns that many have expressed about where our country is in terms of the health of its patients, its population. Frankly, we aren't achieving the goals that many other countries are achieving in terms of not just the longevity, but the wellness of their population. We're putting a huge amount of money into healthcare, but we don't seem to be getting the benefits that other countries are getting with far less expenditures. And that's frustrating because it doesn't look like we're going to be able to solve healthcare just by throwing money at what we're currently doing. We're going to need to make changes. And it calls for population health management. It calls for interventions based on science and evidence to make changes in how we as a society are working with our citizens to make them healthier. Now, there are things that healthcare organizations can do. While we need to go beyond the regular clinic visit and the typical model in which we envision care, there are things that healthcare organizations can pursue that will address population health. Now, what we've done in the article is first organize this by Thomas Friedman's pyramid that illustrates population health and how various different interventions can have a huge impact without requiring a lot of individual work. And that's what we call upon healthcare organizations to do as well, to go beyond the scope of the one-on-one patient-physician interaction and think about what can they do for their entire panel of patients. And it is in fact that respect and understanding that they actually have a duty to all of their patients, both those that present regularly for visits and those who seem to have a hard time getting in and yet still call that healthcare organization their medical home. Using Thomas Friedman's pyramid, we've organized a variety of exemplars, if you will, of good population health management strategies that have been proven in the literature to improve care. And we think that these are inspiring and will be inspiring to healthcare organizations and their members to look at what they can do to improve the health of the panel of patients who call their healthcare organization home. Please take a look at it. I think you'll find it very helpful in your work as we move forward in the 21st century in making our population healthier.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.